Good afternoon, everyone. Welcome to Cafoodle's Natasha's Law webinar today. Thank you all so much for coming on time. My name's Sarah Dovey. I'm the Operations Director for Cafoodle, and I'm delighted to be joined by my two colleagues. So I'll introduce them now. First of all, we've got Louise Wagstaff, and Louise Wagstaff is the chef consultant for Delicious by Design. She works with many different sides of education. So right from the food development companies, some names that you all know very well, through to the schools, universities and local authorities. So a real expert, and I'm delighted to have her on the panel today. Thank you very much for joining us, Louise.
Thank you.
And Nick, same experience, used to work for one of the multinational food service companies and now heads up Delta Procurement, with a lot of his clients being schools. So he can see what's happening day to day on the supply chain at the moment in the schools, and it's going to give us some insight into how we can make things, hopefully make things easier for us all at the moment in this pressured time. So the webinar, welcome Nick, sorry. The webinar today is going to be quite informal. It's going to be questions and answers between Nick and Louise that I'm going to ask them. But what we need to do that is, please, questions from yourselves. And you've got a Q&A slot on the left-hand side of your screen. So please pop your questions in there. Don't worry about if you think they're silly or you're a bit afraid. Just pop any question in there. If we can't answer it, we'll find someone that can afterwards. But I think with these two, we should be able to answer most of them. We are going to record the session. So the session will be recorded. So anyone that can't attend will be able to see it afterwards. And yeah, that is us. We're going to start now. Sorry, one person that I've forgotten to mention, very important person, is Liz. Some of you have already met her, but Liz Morgan, my colleague, is behind the scenes, hopefully guiding me through this, and she will interrupt me if I've forgotten something. Okay, so if Liz comes on, then that's good, because we're going in the right direction. So what we're going to cover today is all about Natasha's Law, and it's great that we can keep it sector specific. We've done a couple of general webinars in the past, but today really going to concentrate on the education sector and get down to the nitty gritty of some specific issues and the ways we need to manage Natasha's Law. But not just covering the law, covering anything from, like we said, supply chain, planning, recipe management, the whole caboodle. So as I said, get your questions in that relate to it. Even if it's not, you think, oh, it's not Natasha's Law covered, you've got Nick and Louise here to be able to help you. So please pop them in. And by the end of the session, hopefully it'll be a lot clearer. You know what you need to do. If hopefully some of you have got plans in place already or working through them. If you haven't, then we will make it easier so that you know what to do. I think that's all I need to say about housekeeping. I think so, yep. So what is Natasha's Law? I mean, most of you have heard about it. There's countless webinars that you can see. There's plenty of information out there. But just to summarize, so Natasha's Law is a new law. It's coming into effect on the 1st of October, okay? And it's relating to stricter requirements for pre-packaged foods, and those pre-packaged foods have to carry a full ingredients list. All right, and that full ingredients list will include the 14 allergens that we know from before. So it's taking the current allergen laws a little bit further and saying, okay, well, if you're pre-packaging something, this is what you need to do. We're going to talk a bit later about what pre-packaging means, what we need to do for it, how we can avoid it, and how we can make us compliant. That's the whole situation. Okay. So I'm going to ask quite a general question first of all, and I'll point it to Louise first of all. So Louise, what are the couple of main things that education businesses need to be doing at the moment to get ready for Natasha's Law?
Okay, thanks for that. I think the key thing for me is, if you've already started, great. If you haven't, it's to look at your business So stand at the side of the consumer and look at all of the food that you have on offer that is pre-packed, ready for sale. This is a real simple way to look at what your offer is, to look at your menu, and also look at your menu for September, because that might be changing, because lots of people in education, we know because of COVID, have just rolled the same menu. So there's a bit of menu fatigue there. So if you're planning your new menu, look at those items that are sealed and ready to go, because if they're not sealed, then they're not covered in the Natasha's Law umbrella, and they are existing allergen legislation that came into 2014 that you should be more than aware of. But this is a really good opportunity now to look at your buying process, menu planning, allergens with Natasha's Law bolted on, just to make sure you've got the through flow there of both these legislations.
That's good advice. And when you say pre-packaged, you're saying sealed and ready to go. Could you just give a couple of examples of some menu items that schools might be doing in that manner?
Yeah, so if you are looking at a secondary school, because I think it probably affects secondary schools, colleges and universities more, where you have a free counter where the students can grab an offer and go to the till on their own, where they're not engaged with a member of staff and it's not being served from a counter. So if it was say a jacket potato, your jacket potatoes might be hot at the counter and you serve the jacket potato, so that doesn't need a label. But the toppings, your cheese, coleslaw, might be chilled and pre-packed in the fridge for them to grab and choose their own. Then those elements would need a label. So for me, from a process point of view, I'd make it really simple. And your jacket potato station would have your toppings, so you're serving it there.
That's a really good example. So straight away, you've eliminated the Natasha's Law compliance by, you still have your jacket potato, you still have your offerings, but it's all being served, or there's a communication between the student and the member of staff. Therefore, no labelling required. Yeah,
and if you wanted it to be pre-portioned, if it didn't have a lid on, it would be fine. So they could just be offered those tubs and serve them. Now, obviously, you could put a sticker and a label on all of those pots if you wanted. But if people are trying to keep it simple from a labelling point of view and just labelling the stuff they have to, it is looking at all the different elements. So I've seen people looking at their sandwich offer, and I've mentioned jacket potatoes now, but just simplifying it. So if it is now going to be a counter service, that there is less options, so it's easier to serve to get that through flow. So it's just different ways to look at it. But the key is we should have great food for the children on offer every day.
100%. And the grab and go offers, are they typically there for speed or choice? What are they there for primarily?
I think it's speed. I mean, if you look at some of the schools, I mean, I've stood in schools and you get, 1,000 pupils through in 40 minutes. There is no other way to support those without the grab and go. So with COVID restrictions and with people doing the social distancing, as there were when the schools first went back, lots of schools did pop-up service areas or delivered to different areas. So that's obviously then made, prepared and distributed from a different area. So all of those items would have had to have been labelled.
Understood. Yeah, understood. Thank you. So Nick, what from a supply chain point of view then, what do you think the main thing that you could be doing at the moment is?
Well, part of it is trying to help the supply chain a little bit. It's under incredible amounts of pressure since we come back from COVID. I mean, I don't think it's any kind of secret of the challenges with trying to find drivers at the moment and warehouse staff. I think people need to get their mindset into the fact that suppliers are working really, really hard to get product to you. The last thing they want to do is let you down. But the clients who are having the least amount of disruption are those that are talking to the suppliers and trying to help change the way that they work to accommodate some of those challenges to the suppliers. So what we're doing is we're seeing some people in schools where they would have placed their order maybe after lunch service, they're placing them now in the mornings. So especially if they're for next day delivery. So they're helping the supplier actually plan a little bit better and get those on the truck. We're asking people as well to look at the stock holding that they have. You know, these challenges are probably going to continue right the way through into the new year. So if you can hold more stock, if you can plan, it helps you just in case there is problems with deliveries coming up and you're not getting exactly the products you thought you were getting when you're trying to menu plan going forward. If you're looking at the amount of deliveries that you take in a week, if you were taking in 3, some of our sites now have been able to increase those orders and actually just take in 2 deliveries a week, again, reducing the impact on the supply chain. And the biggest thing is trying to be flexible. As I said, you know, these guys, all these suppliers, we work with a variety of them. And even though, you know, the ones that we don't as well, we see all of them are desperate to try and help. But the best thing is sit down with them for half an hour, understand some of the challenges they've got, and they'll help you to plan better so you're not kind of you're left a bit disrupted when it comes to deliveries turning up and planning some of the changes with your menus.
And that's something now, so if they are struggling a bit now, they can call up the supplier, and the supplier hopefully will be very keen to have a chat and see how it can be streamlined. Or
yeah,
space is probably going to be an issue at schools, I'm guessing. Storage is going to be an issue.
Yeah, it can be, absolutely. And I think that thing about calling up the suppliers is definitely, I mean, the suppliers have a wealth of knowledge behind them. And there's actually, you know, although some of the people on the call today might not have seen it, there's constant communication coming out to clients to say, look, this is what we're doing. I saw one the other day, you know, that told them exactly how many drivers they were trying to now hire. The fact that they were lobbying Parliament to get longer hours for the drivers to be able to work. The fact that they were taking on so many more contract drivers or remote drivers, they were increasing wages for staff as well. But actually what happens is a lot of these communications get lost. And we also understand that there's so much going on, especially within schools, for people to take in, that actually the only time that sometimes they talk to their reps, they talk to the suppliers, is about getting a product or back. So we would really encourage them, and we've tried to do this, to say to them, look, find your representative from the suppliers, get half an hour with them, sit down with them, and find out how the two of you can make life easier for each other. And it's a conversation that doesn't happen a lot, but we really encourage it, because where it's happening, especially, you know, I have other clients in other sectors, for example, 30 very busy pubs around the Euros. They've sat down with the supply chain and said, right, how can we change the way we work to make life easier for you as well, whilst you get yourself back up to speed and get the workforce back where it should be.
Sensible advice. Thank you very much. Louise, what common mistakes are you hearing in schools or some of your other clients that people are getting confused with the law or current situation?
I think for some people, they've said actually that Natasha's law doesn't affect me. I think that's one of the common things that I've heard. And that is a slight concern, because I think Natasha's law affects everybody. It might not affect your menu today, but I think your staff should be aware of it. So if you're changing your process or suddenly do a different offer, you then might be covered by Natasha's law, and you're not prepared for it. So that would be my big advice, to really review your menu, but look at all the different offers that you have. So if you do sports day or an event, you're suddenly doing picnics or stuff for a school trip, you know, those things that are pre-packed, if they haven't been pre-ordered, will need a label. So it's reviewing every time there's a change of the way that the food is served, that you're just coming back and checking those processes just to make sure it is covered.
Okay, I see what you mean. So yeah, I guess in the past where the child has been able to choose the cheese or the ham sandwich on the day, now that if they pre-ordered, they can have the sandwich that they want. So I'm talking about,
and it doesn't matter, because they've pre-ordered, so it comes under the original allergen legislation from 2014. So when I look at Natasha's law as a whole for education, I think it doesn't affect primary schools as much as it does secondary schools, because as a mum of children, you know, my children up until the age of 11, I sat with them, or I chose what they would have before they went to school. So they knew they would go to school and they'd be having shepherd's pie or the sandwich, and that won't need a label because it's pre-ordered.
Yeah.
For that specific child. It's only when it's pre-ordered for sale and you don't know who's going to be consuming it. So if it's out on a counter to be grabbed or taken from somebody.
That makes a lot of sense. makes a lot of sense. Where, how are your clients getting training? How are they finding out information about Natasha's Law?
I think lots of people, and there is lots of information out there. There's loads of free information on the FSA website. People are speaking to us and talking to us about what they need to do. I mean, for us, we use Cafoodle, and I think it was really interesting for us to look at the things where we need a label and to go through that process and understand how that works. So, for example, I had a clients meeting the other day. First time we'd seen a client for a year, very excited. Did everything COVID safe, and then I thought, oh, as a little treat, we'll make some nice little sort of goodie bags for them to leave. And I thought, actually, had this been in October, it needs a label. So, went through and did all my label processes. And it's those sorts of things that where you've suddenly done something that's different, but they were producing our labels, and it is very easy to do, and pulling all the information down from your recipe. But it's those things when you do something different or ad hoc, or for schools, and we've looked at it when we've looked at hotel clients where your staff all of a sudden there's a banquet running late, your staff, all their food just gets covered and saved for them. That will then need a sticker, even if they're not paying for it. All food that is prepared and covered will need labelling.
Yep, that's yeah. It's honing in on every different situation, isn't it?
It's when your staff ask for food in a different format. I think you need a little flow chart to say, is this wrapped and is it just for general, or is it specifically? So if it was so Sarah, it's for you. You could put it in the fridge with a sticker on for Sarah. I think that would be covered because Sarah ordered that ham salad. It's just, if we didn't know who it was for and you've put up 10 staff meals, then they would all have to be labelled.
Yep, makes good sense. Thank you. So you spoke about software there. Can it be done without software, Louise?
I wouldn't like to be the person that tried, to be fair. I think if you are buying your stuff in that is pre-labelled, you could. Or if you were making your service offer so that you have nothing that needs a label, then I think you can do it without software legitimately. But for me, I think if you're looking at your nutritions and all your other things, this is probably a good time to look at software and Natasha's Law so that you've got it for all the future legislations that are coming as well. So that would be my only bit of advice. So I think you short term, I think you probably can if you change your service offer and make sure that you've got nothing that's wrapped. But ideally, I think from a good practice point of view and for managing it, I don't think you can physically get all of those ingredients in order through a spreadsheet without a lot of time and effort from somebody inputting the data. But I don't know what your view is on this, Nick.
Yeah, I tend to agree, and it may be a really opportune time as well for people to assess their whole procurement kind of side of their system as well, in terms of how they buy. There's still a little bit of a holdback from moving to systems. People are a little bit concerned about it, but if I look at our client base, which I said is very varied, the people are less worried are the ones that have got systems. So I think you could kind of hit, maybe even 2-3 birds with one stone here, because you could talk to someone you said that knows what they're doing in terms of on the Natasha's Law around systems. You could talk to someone that therefore also has the links in terms of moving some of your other processes, ordering and invoicing actually online as well. And it's just going to give you a little bit more transparency, and it will probably make the staff feel a little bit safer as well when they're using systems. I think the handing some of the responsibility to individuals to be doing this is a lot, and it's going to make them feel a little bit uncomfortable. So I completely agree that if it's an opportune time to look at it, do it.
And I think as well for us, we've been using Cafoodle for 4 years, I think. But you don't have to switch overnight. And I think for me, if people haven't started with Natasha's Law, I would say if you just looked at your recipes that are going pre-packed ready for sale, just do those items first, then you can gradually build up your database and your recipes. It's about getting it right. So don't think you've got to go from whatever system you've got in bits of paper and filing to everything online. I think it's something from a recipe database that, you know, you live with and it grows with you, and your staff. So I think it is, you know, you can do it. It's a gradual process. It doesn't need to be an overwhelming, like, how on earth can we do this? I think you could do it just for those items that need to be labelled.
Yeah, that makes sense. And do you think you need to, I mean, current supply chain issues aside, can you still work with smaller suppliers, or do you need to go to the bigger suppliers to ensure that the product information that you're getting is of a standard for your school? I mean, there's obviously mileage, provenance versus, you know, where does it sit, Nick?
Well, no, I think it's a good question. I don't think that you can narrow it down to small or large suppliers. I think really there's going to be a line that's drawn between the ones that are prepared and forward thinking for this. Clearly, from what I'm seeing, some of the national suppliers have got some fantastic information databases backed up, you know, their menu planning, they're looking to help. They've got great resources, but there also are smaller suppliers that have made those stands. And you know, there is the point where there's people that produce packaged goods at the moment, and obviously they've had to take this into consideration. So they're ready for it. But I think, again, it's just going back to this point about communication and just finding out and asking the question straight. Okay, look, I've got these changes coming up in October. I'm going to be buying from you. You need to make my life a little bit easier. How are you going to support me as well during this?
Yeah, that makes sense. So I think we don't use suppliers enough, do we? Genuinely.
No. I mean, the resources are amazing. You know, we've been working with a couple of schools where a contract caterer literally walked out, and we had people put into that position, and we worked with the supplier and the fantastic library of menu planning and support that was available for them. Then there was a nutritionist. Then there was somebody that specifically specialised in that sector. And even for me, you know, I get very involved in numbers a lot of the time, kind of looking at cost of product. But it was a great journey going with that. And by the time you finished, you know, all these resources are there for you. But there seems a lot of the time also a gap between when we first met those suppliers to how our relationship stands with them. And we also then judge it on the fact, a lot of people will judge it on, well, I've got a local rep and he comes in and sees me, you know, and he sells me some new items during that time. Well, it's probably because we don't also prompt that rep sometimes to you know, go back and help us with other parts of the questions, because they're targeted to be on sales. But a lot of those guys and girls are absolutely fantastic, you know, in terms of what they can provide and sit down with you, take through. Most of them are culinary trained as well. So, you know, again, sitting down with those guys, I know working for days, and Louise will know this, you know, both of us, Unilever, many of you guys, you know, some of the detail and support, chef kitchens, development kitchens, you know, that were available to people through customers. You need to explore this. You need to be a bit greedy from your supplier about what else they can help you with.
Yeah, and I know that because from a supplier point of view, with some of the suppliers that I work with now, we've done 3-week menu plans, we've done dessert offers, we've done low sugar, you know, we've looked at all the different portion sizes for different age groups. So we've got a recipe bank of desserts that, you know, people can ping us, we can share, you know, there is lots of stuff out there to help them, you know, and we've already done all the allergen information, everything else around those products as well. So that will really help. So if anyone needs anything, just, you know, ping me after this. It'd be great.
Okay. Yeah, I know. I think we've got a couple of suppliers in the audience as well. So if they want to send us any material, that'd be perfect for us to send out to the audience.
And I think going back to your original question, Sarah, that will be the proof in the pudding when you ask your supplier, are you prepared for this? Yeah. Do you have anything to support me? That'll tell you whether they're probably the right partner going forward. Yeah,
very good point. And you touched on price. I don't want to make this all about cost, Nick, at all. But I mean, there could be some quite easy wins to go to like packaged sandwiches and things like that. But I'm guessing that's going to be cost prohibitive, is it?
Yeah, I mean, there's going to be some challenges around lots of different commodities going forward. You know, we've only seen about a 1% rise so far this year. But if we think about everything that's happening in the market and the potential of Brexit and some of the costs at the moment of imports, exports, we are going to see rises in areas, especially we're seeing now meat, cooking oils, you know, eggs. So one of the things when you're menu planning again, is to sit down with individuals and say to them, okay, look, are you expecting any price rises if you've had your annual price review or your biannual price review? Because again, you've got to take that into account before you start even making any of those changes. Are we expecting to see, we know there's been, for example, bad bird flu cases in Poland, which is a huge exporter of chicken into the country. So again, it's trying to gain information from people. I mean, obviously our clients use us, but I'm sure the suppliers will have the same information coming out to them from their insight teams, so they'll be able to provide you with that. If you start to then think to yourself, okay, well, what I'm going to do is I'm going to maybe carry on with the same menu, but I'm going to move it to someone that produces those, so i.e. they take the responsibility a little bit, so I'm going to move on my menus to be prepared. There is going to be a budget increase. You know, it's going to, you are going to be extra. So again, if that's what you want to do, if that's what you want to move forward, that's fine, but you are going to have to think about how you budget for that.
Okay, yeah, that makes sense. Yeah, it's food for thought though, isn't it? Depending on the operation and the budgets that you have, I don't think it should definitely be one of the things that you look at.
Yeah, I think again is you know, someone came to me once and recently, and they said that they understood what was going to happen, and then they looked at it, but actually the opportunity was they wanted to improve, not reduce. They wanted to improve their kind of street food concept, because they were in an area of the country where they had kids who, that was really what kind of attracted them. You know, that was the kind of food that was being eaten outside, and it wasn't so much the kind of home cooked, you know, shepherd's pies and everything. Street food was the real seller. So again, if that is the case, it's also not a point about going, well, shy away from it. It's going into things, you know, obviously you work with Cafoodle, you know, the guys, but also again, there's huge recipe banks within suppliers that are set up to, again, help kind of, you know, improve that situation. So we're trying to say to people, it's not a point about all negative and moving away. This is a really fresh opportunity to look at what you do and think, how could we start with a blank canvas and nail it all in one go, really?
That makes sense. And also I think it's good time. It's not just about the labelling, it's about how we can communicate menus to pupils and parents, because at the end of the day they want to know what food they're going to be served and what they can eat. So Louise, what ways have you seen that schools have been communicating apart from just the labels? How do they communicate in advance?
Well, most schools just run their standard menu cycle. It's all online. Lots of people have those online services, so you can look. I mean, one of the things that I think is a really good practice, and most schools do, is if your child has an allergy, you know, you register it with the school. So I know in schools that I've been involved with, you know that you have 4 kiwi allergens, you know, 3 gluten-free. So it's very clear. And I think even when Natasha's law comes in, my concern is that some parents might not be doing that as actively because they just think that the schools are owning it more now. And I think it's really key that the child and the parents still own. This is about everybody working together so that there's safe food for all. I think those children, the key thing is this is about safe food.
Yeah.
So yeah, it is through the menus, it's through correct labelling. And most books, when I was part of the Universal Infant Preschool Meals auditing, I did Oxford books for the Craft Guild. We saw great processes in place and implemented great processes. So, you know, especially in the small schools, you know, you'd have the picture of the child with their allergens. So it's very easy from behind the counter to know whether whoever was serving would know that that was Alice and she couldn't have dairy. And it would be in the pre-production meeting to say, you know, today Alice is booked in, she's got a milk allergen, so there's a separate custard for Alice, or, you know, Alice has got a different dessert. So it's about having those processes still in place to support the children with the allergens, so that it's inclusive as well, isn't it? And it is great food for all.
Yeah, absolutely.
Sorry, Liz here. I've got a couple of questions that I'm going to throw in because they're kind of good timing. Because we were talking about that. One of them is, can you talk about allergen champions and parent guides? That kind of ties in possibly nicely, Louise, with your processes and kind of advocates within the schools and how that they work. And another one as well that we have is coming back to the earlier conversation around labelling, is there going to be a standard UK label?
Okay, so let's cover the label first. So the standard is what you need to have on the label. There's a very good example on the FSA website. I think it's a cheese and pickle sandwich, and we've got some on our cafoodle sites as well. We've got the standard what we call it's, so it's not every label has to look exactly like this, but every label has to include this information. So what I will do is highlight those two areas to go for, and then you can see what has to be included in the label. But yeah, thank you, Liz. So going back to allergen champions, I mean, Liz, have you got some best practice examples of where you've seen communication with parents and champions really come to its fore?
For me, I think, yeah, obviously you need somebody at the unit to be a champion, but I'm a believer in that everybody should have that same knowledge. So everybody that is involved is trained to a basic level on allergens. So I think one of the key things is you have somebody that is overall responsible, but lots of the team are aware and understand the differences of allergens, communication, and also whether the hypersensitivity, so whether it is an allergen, an intolerance, or if someone's got celiac disease, because it's very important that they understand the differences, but they're all treated in exactly the same way, and also with the same amount of respect to make sure that, you know, that person isn't made poorly. So whether, you know, it's serious and it's hospitalisation, or if they're just a bit upset and tummy, because, you know, if they're small and they're getting an upset tummy at school, that's not great at all, is it? So even all of those intolerances need to be taken very seriously so that it is addressed and worked through with the school. And I think most schools that I've dealt with are on it. They just need the parents to tell them. What you don't need is, my child's allergic to broccoli, just because they don't like broccoli. Oh, yeah. I think that's the issue that some schools have, and from a processing point of view, very difficult, isn't it? You know, when you start seeing things like, we need a doctor's letter to confirm this. Well, we shouldn't need a doctor's letter, but we need parents to be responsible and give that information as accurate as they can, and also manage it. I did a workshop for some children in one of my local schools as a volunteer, and one of the children, we were making edible necklaces, and we had allergen. Everyone filled in the forms, no allergens. Mum ticked no allergens. This girl literally passed out in front of us, and she was 6. Swept her up straight to the office and said, "Who is this?" And she had a kiwi allergy, and the mother had ticked to say she hadn't got an allergy. And for me, you know, the teacher had brought her through, but it was a TA on the day that didn't normally look after that class. So it, you know, you could see everywhere where it fell over. The mother didn't fill it properly. The teacher, when we checked and said, "Is there anything we should know?" didn't know those children, and it was fine, and we dealt with it. But for people involved, it's an awful thing to be exposed to, isn't it?
Oh, totally, yeah. Especially when you think all the due diligence have been in place,
yeah.
And all you're there to do is make them a happy experience with the necklaces. Yeah.
Oh, and the best thing was, I got home after the trauma to a complaint where someone said they were a bit disappointed that their child turned up with string when they were collected, and they actually did 4 activities. It was for a village show, and it was because the child had ate it before the mother picked them up. So I just returned her £2 and said I was very sorry. I didn't have the heart to say after the afternoon I'd had. But
here you are. Oh gosh, you can't win. You can't win.
£2 back. But for me, I think this is an important point from a school point of view. So I get involved with stuff with the caterers, but there are lots of people, like for me in my local school, we get involved and we do other things with the food. So, you know, the PTA might turn up and do something at the school. So it's the catering team and the school need to really encompass everything that goes on within their school to make sure all those volunteers are supporting and working to the same rules. I mean, we had one incident where there was a problem at a school, so we went and did an audit, and actually it was because the parent group ran a breakfast drop-in centre. So, and we had a gluten-free child that was being poorly that day, but it was because they'd only got 1 toaster, and they'd got the gluten-free toast, but they didn't know that they needed separate equipment. And it is those, but the catering staff knew that. But
Yep.
actually, like, who else serves this child food? And it came back to, yeah, there's a weakness there.
Yeah, and it's communication training. I don't think we're not going to say that enough during the webinar, are we? One of the things we're looking at Cafoodle actually at the moment with one of our clients, we were given a grant by Safety Accelerator to improve safety through schools by not just communicating the 14 allergens, but communicating all the ingredients within a dish. So you mentioned some of the things that people are allergic to. It's not just the 14 now, is it? So we're quite proud of that, and we're going to do some more press on that probably August before it gets launched. It's just another way that we can communicate, get everyone involved, and the seniors getting them taking ownership of what they're eating and being able to see what they want. Let's go back to some questions then. So let's ask this one. So someone's asked, what's our opinion on printed labels? Because like we mentioned earlier, if they're going to, they want to just grab and go, sometimes the labels aren't eligible. Are they going to have time to, are we expecting a child to read a label, I think is what we're saying.
Well, I mean, I think the law states that we just need to put a label on, following the guidelines where the font is of a certain size and the allergens are in bold. You can't make the child read the label. I think the information is there. And, you're talking probably 8% of children with allergens, I think it is. So, it will only be the children that have the allergens, I'm presuming, will need to read the label.
Yeah.
It's just there for everyone. I mean, the concern for me is my daughter quite often, she'll say, oh, I was late to the queue, so I just shared something, or someone else grabbed me something. It's for those instances. So that child might not read it, but actually if they're sharing it, then the child that they're sharing it with does need that information still.
Yeah, no, they do. And we need to try and get people away from handwriting labels, don't we? Because you say now it is quite specific in terms of the font size that it can use, how much space it takes on the label. There's a lot of information that needs to go on there. So, but more than that, it's got to be legible. The kids have got to be able to read it.
Yeah, I don't think you could handwrite one personally. Do
No.
you think you could handwrite a label to meet the legal regulation? For me, I think if you haven't got time to write labels, it should be an open counter and you are serving the sandwiches so they're not sealed. It's in a bag that is open at the end, so that it is served to the person, so that then you don't need a label. That would be my advice for those people that can't do labelling properly.
Yeah, that makes sense. Nick, when we spoke yesterday, you were talking about some other options, weren't you, to kind of replace grab and go? You'd seen some of your clients putting them in recently.
Yeah, it's down to facilities though. But we've certainly got some clients in schools that are going to start replacing sandwiches. They're very conscious, going back to Louise's point about not having 1,000 children turn up and asking them what they want in a sandwich, or 12 different types of topping on a pizza, is that they're going to have a couple of options of pizza ready to go, not packaged during that time. And again, I think you also mentioned it, Louise, is about having a jacket potato station. Because the danger is as well is that you want to try and keep things a little bit healthy. So I know pizza is obviously great, but having the jacket potato station allows them to try and work to a little bit of a more health conscious state.
Yeah.
I think especially something like a jacket, because you could have a nice veggie curry or other stuff in there, can't you? You can definitely get a whole meal in those pots. I've seen some great noodle pots with stir fry veg and stuff. So still that sort of from a counter, they can grab it quick and easy. So there are some healthy options that fit within that counter still. I
think also budgeting wise as well, Louise, what we mentioned before about if we're thinking about getting an external supplier in, which, great, that's a good option for some people, but in some schools' budgets, that's not going to hit, so by doing something like a jacket potato station and making that work, they're going to keep within the original budgets that they had.
Yeah, and hopefully we can get the children through quite quickly with that option. The pots of chilies. Yeah.
Look, these things are not going to work for all different types of schools. They're not going to work. Some of them are not going to work in primary schools. Some of them are not going to work in secondary schools. But again, it's the sitting down and planning now. And I do have a concern, certainly seeing some people where they're expecting to come back in September and take this up. And when we were originally talking about the supply chain, you know, just to give you an idea at the moment, we pretty much over the next 2 weeks will take every order for every school we've got already for September. So that's not for delivery, but that's so that it can be forecasted for the depots, because we've got 2 D-days coming up. You know, we've got July the 19th, where everyone's going to go crazy and take their masks off. And, you know, again, if you look back at the last few weeks, some wholesalers have had a busier day than they will have at Christmas some days in terms of the demand. So you've got that day, first of all. And then whilst everyone's onboarding themselves and trying to get transportation teams up and warehouses back and stock and everything in place, you suddenly got this day in September where everybody heads back to school and everybody's placed their order. So those schools that are working towards this now will be placing their orders ready for delivery in September over the next 2 weeks, which means that their menu planning and what they're going to be serving, they're aiming to have it fit with Natasha's Law from September, not October. And that worries me that a few people outside that that we've come across haven't even thought about this yet.
Yeah. There's not much time left now.
Yeah, I think that's a really good point, Nick, because for me, you would like to think if they implement their menu with Natasha's Law on return in September, they've got 3 weeks then just to iron out any issues, to go through and check their processes and make sure it's all there, as opposed to checking the printer on the 30th of September and realising the stickers are the wrong size.
Well, the other thing as well, Lou, is that, you know, already people will have experienced quite a bit of substitution on deliveries.
I was going to ask about substitution. How are they going to deal with that?
Well, again, if you've got a systems, it's about making sure that probably options 1, 2, and 3 are in for all levels of products actually within the system, and that helps you. It's going to be a struggle if you're doing this on your own, and I think we've all said it's going to be very hard for anyone in that capacity to do it on their own without a system. But I can't see there not still being some stock issues and some substitutions going through for the rest of this year. It's going to be the nature of it. So we have to have some kind of flexibility. So I would be, when I'm planning menus, I'd be thinking to myself, okay, right, is there 2, 3 different order lines that fit in this menu? And therefore, if I can't get one, I'm automatically saying that I want to, or I'm registering that with my supplier, that I want this as a substitution. And the other thing, you can put locks on your account. You can put locks saying no substitutions. So if it's not available, then it has to be shown at order point to say, look, I won't accept anything else because it has to fit into this menu and this allergen and the labels and everything that we're doing.
I knew you could say no, but I didn't know you could put second and third options. That's interesting.
You can with most suppliers, whether they do it with their own online systems and websites, but certainly you can put hierarchies in place where and notes on it that there cannot be any substitutions with on your account. Most suppliers will do that. And again, you can refuse them at the point of delivery, should you need to. And the other thing to check with that as well, and the suppliers will probably moan me when I say this, but sometimes when substitutions come in, they're not as cost effective as the original products that you'd negotiated. So again, it's just worth keeping an eye on some of the prices, because substitutions are going to be here for some time.
So it's not like Tesco's where they give it to you for the same price.
If you've got a good supplier, they might do. Yeah, absolutely. But generally, I spend most of my day as a procurement consultant going back through invoices, looking at substitutions, and then going back and negotiating them. So no, it's not happening everywhere at the moment.
But it's really important. Again, your policy must include how you manage substitutions, and because it's the unknown, isn't it? You've got all your allergens listed. You've got your menus planned. You get a Hellmann's instead of a Heinz product. Different allergens, different ingredients. Sorry, not name dropping.
It's fine. And I think the thing for me is, because we all know that there are issues with the suppliers, I think, and we still have people to feed, especially in schools. It's not like a pub where you can say, actually, we can just cross things off the menu. I think there needs to be a process in place. So there is this sort of, we will refuse any substitutions, or we can take A and B. But I think for me, when you're menu planning, just some store cupboard ingredients and stuff that you've got in your freezer to cover those days, and actually to build up your stock and carry a couple of extra days of meals for your children. So actually you have not got someone running out Sand and Tesco. It's like, actually, what is our go-to? And this isn't just about Natasha's Law and allergens. We had this with COVID. It's like, you know, what happens? I've got friends in care homes. What happens when all of your chefs say, I've tested positive? So who delivers the meals and what do we do? So I think it's the same process, isn't it? It's like, what happens if we have a disaster? So the disaster could be we've got no staff, we've got no delivery, but you still need to feed 100 children, 300 children. So it's getting those stock levels in, whether it's a store cupboard or, you know, a freezer items, and just a couple of days surplus so that you know what you've got that can be put on the menu safely, because the allergies have been all identified. You've got all the recipes done for those recipes, because the problem you have is when somebody just nips out and buys something, isn't it? That's when it all falls down, Nick. So from
absolutely, and I'm you know, I am very empathetic about people's storage issues, and you know, I know that sometimes it's a struggle, but also being devil's advocate in that, over the years, people have got into a habit of, I will live hand to mouth, in terms of everything I want for that day turns up first thing in the morning, and then it's cooked. You know, I have Victorian pubs in London with storage place the size of a small downstairs toilet that sell £50,000 worth of food a week, and they take no more than 2 to 3 deliveries a week, and they find a way. So again, it's, you know, I'm not being flippant about people's storage, but there is a time to go to ourselves, okay, right, well, let's start scratch. If we weren't doing all the deliveries, we were holding more stock, what could we do? Can we put another freezer in? Can we do something to help ourselves hold stock, so that, as Louise said, suddenly everyone goes down, realistically, in your mind, somebody should be able to walk into that kitchen and prepare food for at least 2 days whilst you get more stock in. But I know it's a perfect world. I said I'm not being flippant, but sometimes we have to be a little bit self-critical about how much stock we can hold, and the more the better.
Yep. No, it's good advice. Very good. Right. I don't think we've got any more questions. Liz, can you just confirm?
I would say possibly just the one, again, coming back to labelling, where it's around the descriptive name, because this can seem to cause a bit of confusion. So if there's a simplistic way that we can help the audience, that would be fantastic.
Well, I have done extensive research on descriptive names recently. So it's got to explain what you're serving on the dish. If it's not customary or legal, so customary would be something like a Battenberg cake. Louise is going to nod if I'm saying the right things now. I'll shake her hand. Give me another example of a dish that everyone knows about. Can't think of one off the top of my head. Oh, Cornish pasty, something like that. So it's a customary name that everyone knows about. There are a few ingredients that have a legal name. So some of the fishes and some of the fresh products have a very specific name that you use them. If it's none of those, then the food label has to have a descriptive name. Okay, so you can't just say it's a sandwich. You can't just say it's a cheese sandwich. You have to say it's a cheese sandwich with white bread and margarine. All right, and therefore that person knows, oh, it's white bread, it's margarine. I'm okay with cheese, white bread, margarine. I'm good. Does that make sense, Liz?
It does to me, and that's good. I haven't got any quick fire questions coming in, so I'm hoping it clear sense to the audience as well. So that's kind of that question. And also, coming back to the ingredients and composite ingredients, because again, there seems to be a topic, an area of conversation around here that with the change to the law, does it include obviously the composite ingredients as well?
Louise, do you want to take that one?
Yes, no, it does. So for Natasha's Law, for your label, you have to list every ingredient and the ingredient within an ingredient. So when I've looked at this, so for example, if it was a bacon bath with brown sauce, you can't just put brown bath, bacon, brown sauce. You say brown bread. You then list the ingredients that are in the brown bread, then your bacon, any of your sulfites or anything that else is in your bacon, and then list everything that is in your brown sauce. So it all needs to be listed. And what I found is when you've been looking at labels or the way people are going to implement this, you might want to look back at some of your recipes and slightly simplify them, because you suddenly didn't realise that that one component had 17 ingredients and your label looks huge. And I think especially for some of the people that have got sort of fresh brands, or, you know, it's all natural food, you know, people might really be looking at keeping it simple, and perhaps putting you're serving your sachets separately, so that's already labelled in its own right. So you might just do your bacon roll in there, and then people choose their own sauce as the sachet. But that comes back to a costing from Nick's point of view. But from a simplified point of view, it means then that, you know, you've just got one bacon roll, and then they choose their sauce, as an example.
Yeah, that's a really good example. We were looking at, so we're doing some testing on our labelling, and, you know, so we got a recipe with a stock cube, so it had to list all the stock cube ingredients, you know, and it's like, yeah, let's try and simplify the recipes, and also if it's not Natasha's Law compliant, then you don't need to do that whole thing. So there's fine, just getting it right, making sure you've got the composite ingredients. So all suppliers now are sending them through really well, in terms of they're not just putting the allergen information through to us, they're putting the nutrition information, and now all the composite ingredient is coming through from the, so it's all there, it's just ready to be printed out in the label in the right format.
And I think that's a really good example, because I find actually when you look at stocks, there are lots of different stocks, and from a chef's point of view, you're in the kitchen, it could easily be substituted. And I've seen, you know, own labels suddenly turn up which will have extra allergens in. It might suddenly have a celery in there, some of them have wheat in. So something like a stock, a chef, when you've got on you're looking at your recipe template, it's really important to put the brand of the product that you're using. So when they're looking at the recipe, they know it is a Knorr stock or a Bisto stock or a Break Zone label stock, so that they're using the right one. And then you have a process in place that they can flag to say, actually, that isn't the one we've got, this recipe is incorrect.
Yeah, even that small detail and the effect of that cube, you're absolutely right. Get the brand name in there, make sure everyone knows what they should be using.
And it's the right flavour, because you might have run out of chicken, so you put egg in. Yeah, It's really retraining some of the chefs and some of their habits and processes and the way they work. But it's down to training for them to understand. So I think once people understand the processes, it's second nature. If they don't understand actually that there is significant allergen differences between the stock cubes, that's where they might fall over. And it is owning that process from delivery. So if you only ever have one stock cube in or one stock bouillon paste, it doesn't make a difference. It's if you've got a couple of options or you've had a substitution, it's managing that process through, so it is correct at the time of serving. Because you might have a delivery, but you might not use that product for 2 weeks.
Yep. Cool. Right, I'm going to wrap it up now. First of all, I'd just like to thank Nick and Louise. You've both been fantastic guests. Really do appreciate the time that you've given us today and the information. Thank you very much. I think they've both referenced, and myself, quite a few resources. So I will send an email out to all the attendees with some of the sites that we've mentioned, particularly FSA website, some of the labelling guidelines that we've mentioned, descriptive names. And do come back to us if there's anything else that you need. As I say, we'll try and get some of the suppliers to send some resources as well if we can, and just build up a template. We'll publish it all on the website and we'll send it out to you. Aside from that, I just want to say thank you to all of you for attending. Any feedback that you have, do send it to me, and we will see you soon. Thank you very much, everyone.
Thank you.
Bye-bye.